Hello, I'm Dr. Siapko with Cascadia Eye, and today I'd like to talk to you about lid scrubs. So before we talk about lid scrubs, I'd like to talk a little bit about the anatomy of the eye. So the eye and the eyelid are more complicated than you might imagine. The tear film itself, instead of just being a layer of water, is actually three distinct layers. The bottom layer, which is up against the surface of the eye, is a mucus layer. The second layer is a watery or aqueous layer in the middle. And then you have an oily layer or a lipid layer at the very top of your tears. This oily layer is what we will be specifically focusing in on because it is really important in keeping the tear film or the tear layer of your eye extremely stable so that you can read and see appropriately. The oil layer is actually produced by these specialized glands on the eyelids. These glands are called the meibomian glands. These meibomian glands release oil every time you blink, and that oil coats the surface of the tear layer and prevents them from evaporating. So there are three main reasons why you would be asked by your doctor to do lid scrubs. The first reason is a condition called meibomian gland dysfunction. Now, this condition is a problem that people inherit genetically, meaning you probably got it from your parents. This condition will make a person susceptible to plugging up of these glands, in which case the oil layer becomes deficient. Now, with these sorts of problems, what happens is the tear film can become very, very irregular and unstable. And these patients can have symptoms like blurring vision, especially when they're reading or watching TV, or itchy and dry and irritated eyes, or even red eyes. These patients are also more susceptible to styes. We call them chalasia here in the office, but they're painful red bumps that can show up on your eyelids that can take months and months to go away. So a second reason that your doctor would ask you to do lid scrubs is to help treat dry eye. As I told you before, the oil layer in the eye is extremely important in keeping the watery layer from evaporating. With age, we all tend to produce fewer and fewer tears, and when your doctor is trying to treat a deficient watery layer, he really wants to make sure that the oil layer is really healthy in order to keep the amount of tears in your eyes stable and to keep evaporation from taking the tears from your eye. The third reason your doctor might ask you to do lid scrubs is to prepare for cataract surgery. A lot of bacteria live on the eyelashes and the eyelids, and they are frequently the cause of infections after cataract surgery. Your surgeon therefore asks you to do the scrubs in order to reduce the number of bacteria and minimize the chance of getting an infection after cataract surgery. If you have any questions about this or any other eye issue, please feel free to contact us at the following link.